Go.
Okay. Now we're going to be, after suctioning, you always have to suction before you do your trach care. Why? Sometimes because if you didn't suction them and you're just working and cleaning them, they start coughing and all the sputum or the mucus will start coming out, and then your whole thing is a mess. So it's better to always suction before you clean your trach. So what I have here, I have a spare clean gloves, have my peroxide, which I will open now, and so is my saline. Now the same way, I'm going to open them both. I'm going to take my gloves, remember this is just clean technique right here. I will remove this old dressing. I will loosen this trach. Remember, there's all kinds of trachs, so you need to study all the mannequins we have. They have different kind of trachs. And also some people will have disposable trachs sometimes, so you need to be aware that sometimes you don't have to clean the trach. But there might be a time that you might encounter a metal trach, and you will need to clean that. So now I'm going to get my stuff ready. There's different ways to do it. Sunny side down. You can either do this, now I can put peroxide, saline, and depending on the facility, sometimes you want peroxide mixed with saline. So you need to make sure to adhere to facilities rules and regulations. So now I can wear my gloves. Okay, first thing I will do is straighten up my stuff using the cotton swabs. Now there's other ways to do it. Sometimes some people put their saline and the cotton swab on the peroxide and saline. Since, oops, still sterile. Okay, that will be the last thing I'm going to do. So I will. Okay, now this is going to be my designated non-dominant hand, so I will remove this. Let it soak in the peroxide. Now if it's disposable, you can get the new one and just put it right in. So first thing now I'm going to dip my cotton on peroxide. So I have one swipe. This is my garbage. Another on the top. Now I have my saline. Rinse it. Sometimes you will find the patient's trach is, the site is very, there's crustiness in there, so I will use this, dip it in my peroxide, and try to clean that. I'll do the same thing on the other side. You see here, I'm not touching the skin because I wrap my finger with the gauze. Now I'm gonna rinse it with saline, of course, same way. Now I'm ready to clean the trach. Since this is sterile, so this will be we'll pick up the brush. And I can hold this because this is the outside, so I can hold this and start cleaning it. Now I can rinse it with saline. And put it in there. Now since I'm already putting this in, I can change hands. As far as the ties here, I'm gonna see if it's dirty or do I need to change it. It's pretty clean, so I'll go ahead and put the dressing. Take everything out, away from the patient, make sure he's in comfortable position. The rails are up. Make sure the rails are up, and tell them before you leave the room, ask them if they need anything.